This is me, heart and soul. Here's a part of me the world may never know. Here's my story. When I lose, I let my guard down. Here's the naked truth. I let my guard down. Here's the naked truth. I let my guard down. I let my guard down. I let my guard down. Here's the naked truth.
My people, what is going on? This is your boy Monroe, aka He Smiles, your host, your proud host, as I always say, of the Naked Truth Experience. Now listen, come on in the room. I want to welcome you all back. This is episode 26. And if you've been here since episode 1, I love you. I appreciate you. If you're just tuning in for the first time, I love you. I appreciate it. And any time in between, once again, I love you and I appreciate you. Thank you for coming back. Now, listen, tonight we are going to dive right in because we've got a very special guest, Dr. Cedric Jamie Rutland, and he's going to be here. And I'm going to talk about our topic in just a moment. But we want to honor his time because he's actually fitting us in to his rotation. So I really appreciate him. So what I'm asking you to do right now is tell people about the show. Don't come late. Let's go. So like, share, comment. Also, make sure that you like, you share, and you subscribe. Like our Facebook page. Please share our Facebook page. Comment on our social media. Like our social media page on IG. And then make sure you subscribe to our YouTube channel. Also, most importantly, please go and become a part of our Facebook group, the Naked Truth Experience Facebook group. It is so important because we want to continue the conversations there. Now, also, tonight we have a doctor in the house who has extensive knowledge with COVID-19. He's done a lot of research and he's going to share some of that with us tonight. But if you have any questions, you all, I want you to please get in those comments. Our producer, Julius, will be paying close attention to those comments. And if we have time tonight, we will definitely take some of those live questions. Some of you have already submitted your questions via our social media, and I'm definitely going to try to incorporate as many possible in tonight's conversation. Again, come on in the room, talk to your community members, let us know what you're sipping on. Speaking of what you're sipping on, I'm sipping on something tonight. And Dan, where you at? Let's bring our wine guy, Dan Cericia. He is back all the way from Napa.
Hey.
Dan, what's going on, man?
How's everybody doing?
Listen, it is so great to have you back once again. Now I got to check in with you, man. How are things going? How's the fires out there? How's that going?
You know, we're maintaining. We're happy to report we're at 50% containment and growing here in the valley. And I think we're doing all right. We got a lot of recoup work to do, but all in all, I think most of us are plugging away and in good spirits. Excited to be here, Monroe.
Listen, I'm excited to have you back, man. Dan, you are such an asset to this show, and we're so glad to now have you part of the team. And you recommended a wine for me this week that comes all the way from South Africa. Yes.
Yeah, it's so easy to talk about wines in our backyard, Monroe. And, we were talking about one of the easiest ways to travel the world, if you don't got a plane ticket, is to do it through food and wine. On our theme this week, I'm really excited to recommend this one because it's made by a really amazing winemaker. And once again, we got another first female Black winemaker in all of South Africa. Her name is Nsiki Payela.
Wow.
She's amazing, really educated. She even went to school to do this at the University of Stellenbosch, I believe.
Wow.
If any of you guys do any research, put a little tag on and correct me if I'm wrong. Right? I just love these wines so much. And one of the reasons I like South Africa is because unlike the United States, there's a lot of different aromas that we can't produce. And one of the earthy qualities of wine, or one of the qualities of wine, I should say, is earth smells and aromas and scents and flavors. And we're a juicy wine drinking culture here in the United States, right? We love it like we like our soft drink. But this one is a really fun one. And then rather than me tell you about the wine, I want you to tell us about the
Okay,
wine. We'll
okay.
go right through it, all right? Let's see.
So Dan is going to show us. He's going to show me, and in turn, showing the rest of us how we should do a tasting. Before we do that, I'm going to ask Julius, can you please go ahead and put the slide up? We want to see what wine we are sipping tonight. Yes, there we go. Now listen, Sansane Red Blend. I hope I said that correctly. Aslina 2017. Okay, again from South Africa. So Dan, you had me print out this wine, this wheel here, right? So I've got my okay. All right. So I've got my wheel. So talk to us. What should I do when I want to taste a wine? What am I looking for? How do I approach this?
All right, cool. So I get this all the time in wine tastings, and the first thing is keep it easy. We go with our senses, top to bottom: eyes, nose, mouth. All right.
Okay.
So let's start off with just looking at the wine, because the appearance of the wine is important. Okay. If you pour something in it and you're like, oh, there's a floater in it, who knows? Maybe it's a piece of cork. Right. Also, sometimes wine is supposed to be very thin and clear, and other times you can look through it and it's like ink. That's going to tell us a lot about the wine, how many clusters, all of that type of stuff. And so what we're really doing is kind of getting a gauge, just training our brain to take it in. The next step, and that's just the appearance. We're just getting an idea. Does it look okay? Yeah. The next step is our nose, and that's where the color, that's where the aroma wheel comes in. Just like a pasta sauce, there's tons of different ingredients. But when you taste a pasta sauce, you taste it all together. It's really hard to say, oh, there's a little bit of garlic, there's a little bit of oregano, there's all these different spices. Well, we're trying to do the same thing when we assess a wine to determine what we like about it or what we don't like about it.
Got it. So
here we go. Let's go and take a look at this. So it's a red wine. Let's take a look at the wheel. As you look at that little wheel, there's a bunch of different aromas and flavors and stuff on there that you can read. You have to prompt your mind. So as you go through this, give it a little spinny spin. You know, wake up the wine from its hibernation. You know, get some oxygen stirred in there.
All right. All right.
All right. All right, so now you're probably like, I smell wine, right? I smell wine. Okay.
That's what I was gonna say. I smell wine, but I'm gonna get better. So what should I? So I see on this.
You gotta.
I see on this wheel. So I see on this wheel. I see woody. I see caramel, nutty, fruity, spicy, floral, chemical. Oh my gosh,
that's not a good one. We don't want chemical.
All right. So So if I had to guess, let me try this. This is live and direct, y'all. This is live and direct. I'm learning along with you. So
no pre-script here, y'all.
Okay. So smelling it. I would have to say, if I look at my aroma wheel, I don't smell spicy, floral. I think I might go with earthy. Between maybe earthy or woody. I don't know.
100% both. Absolutely.
Okay.
So now we got a red wine, right? So it would make sense that there would be some sense of red fruit. With white wines, we're looking at peaches and non-red fruits. So for the most part, if we're looking at red wine, let's go to the red area. Do you smell, and it'll kind of go, you got some strawberries versus black fruits, maybe like plum or anything like that. What type of red or black fruits might you get in there?
Listen, I don't know. We may have to fast forward because we only have 1 minute left in this segment. But this is a great start, okay? Because we first talked about like what we can see. Now I've got this aroma wheel, so I'm starting to see what I can taste, right? Eyes, nose, and mouth. Yes, good to know about the wine. Thank you, Julius. And then you said the next thing is the actual taste, right? So we're going into the tasting of it. Okay.
Yeah. All right. So once we've done kind of training our brain and trying to assess some things, let's give it a straight taste. Now here's a fun fact.
It's not sweet. It's not sweet. Okay. No. So it's not sweet. I can say that.
Oh, feel the texture of the wine. So when you feel, when you bite into a banana, and it kind of, you get that tannin, that stick on your teeth, or if you have tea and you get that grip, that's telling you about the tannins in the wine. That'll give you a little bit of expression as well. You may or may not like that. And the whole objective of this, y'all, is to see different types of things and explore different types of wine and what they are like. And you may not like them, but at least you had an experience.
I definitely had an experience here, and it was a learning experience. And I'm so glad that we were able to feature this wine. Listen, ladies and gentlemen, I want to thank Dan, the wine guy. You can find him at the Little Wine Guy on IG. He knows what he's talking about, y'all. Dan, thank you so much, man. Always be safe, and I'll see you next week.
Take it easy, y'all.
Now to the coronavirus here in the U.S. and the dire new warning tonight as we now head into fall and winter.
As the coronavirus killed more than 200,000 Americans, President Trump pretended that it was no big deal.
Controlling COVID is all about limiting the amount of virus in the air.
A contagious commander-in-chief at home and at risk of spreading both the virus and bad information.
At least 16 states have reported increases, and in the last 24 hours across the U.S., more than 21,000 new cases, 1,000 new deaths.
The test that you do right then and there does not detect down to the lower levels of virus.
Would see what they're doing isn't working and would change. But this is going to go down as one of the worst responses to a pandemic.
Listen, welcome back, you guys. So if you haven't deduced by now, we are talking about COVID-19 Deconstructed. And I have a wonderful guest tonight, a very special guest, because we have history. We go way back, all the way to high school. Dr. Cedric Jamie Rutland. Dr. J. Rutland, you there, my brother? Where are you at? Okay, we're having a little bit of buffering on his feed. He's right here. He's right here. We're just waiting for that video to come in. There he is. Everybody, I want you to welcome to the show, Dr. Jamie Rutland. Dr. Rutland, how you doing tonight, man?
I'm doing all right, man. I got to be in the ICU in about 50 minutes, but I'm doing all right. How are you guys doing?
Listen, doing good, man. Like I said before, we were going to dive in because I appreciate you squeezing us in. For those of you who don't know, which most of you may not know, man, Jamie and I go way back. Listen, we actually took the best friend homecoming dates to homecoming one year. We went to high school together. My claim to fame for a while was that my picture was in Raphael Sadiq from Tony in his house because of Jamie Rutland. He lived next door to him.
I was with him on Saturday.
Oh, that's what's up, man. That's what's up. That was my claim to fame for a long time. Jamie, I want to thank you. Big ups to CB Christian Brothers High School in Sacramento. Hopefully y'all are watching tonight and supporting, because two of your alum are here tonight. Jamie, you're on the West Coast, and you are a pulmonary critical care MD. For those folks who may not know that particular specialization, what do you specialize in your practice?
Yeah, so whenever you go to medical school and you're becoming a physician, right, you go through medical school, everybody does that. And then after medical school, you kind of select your specialty. So for me, I selected internal medicine, which is basically a physician who can take care of any organ in the body. And then I selected an organ called the lung that I especially take care of, right? And then on top of that, I also did the intensive care unit. So I'm a triple board certified pulmonary, internal medicine, and critical care physician.
Wow. So when we talk about COVID-19, which is associated with the respiratory system, we are definitely talking to the right person right here, right? Because that is your specialty, is the lungs, right? And how that may impact that. Now, I am not a physician, so are the lungs, this may sound a stupid question, but I'm going to ask it anyway. Are the lungs part of the respiratory system, or are they separate?
The lungs are part of the respiratory system. So if you guys are taking a deep breath right now, and I would encourage all of you guys to take a big deep breath in, as that air travels down this windpipe, it breaks down to a right and left main windpipe, which are the beginnings of the lungs. And the lungs essentially are a bunch of pipes that lead to balloons stacked on top of one another.
Got it. Okay. So you host a show on YouTube called Medicine Deconstructed, and you are frequently going live. You have your own IG channel. You have a great following, all of that. And you are constantly taking very complex terms and very complex concepts that are medical and really kind of just breaking them down. And I've watched a lot of your videos and seen the comments. People love your honesty. And you're here on today, The Naked Truth. So we appreciate your honesty today. So what is your honest assessment of where we are right now in our medical knowledge? And if you think about it in terms of colleagues, overall physicians, what is our medical kind of understanding of COVID-19? Do you feel like as a medical community, we know a lot about it and it's common knowledge at this point?
Yeah, so I think first of all, the nomenclature has to be correct. One of my pet peeves as a pulmonary critical care physician is everybody throws around COVID, COVID, COVID. Listen, SARS coronavirus 2 is the virus that causes COVID-19, which is a disease. COVID-19 is a disease. So that is the pneumonia and the complications that you get as a result of the virus's presence within your body, whereas SARS-CoV-2 is just the virus. So our medical knowledge on SARS-CoV-2 is actually pretty robust. It's pretty decent. We know how the virus is structured.
Oh, we're having a little bit of
circle.
Hey, Dr. Rutland.
No?
Dr. Rutland,
Yeah,
you're
can you hear me?
the last thing I heard you say is that we know how the virus is structured. That's what we heard you say.
We know how the virus is structured. In other words, we know what it looks like. We know the proteins that it consists within the virus and on the membrane, and we know basically how those proteins act. Now, the problem that we're having with SARS-CoV-2. Oh, let me just go into this a little bit more. There are 7 different coronaviruses that infect humans. 3 of them are serious: MERS, SARS-CoV-1, and SARS-CoV-2. And then the other 4 are common respiratory viruses that cause the common cold in 33% of adults. But when you think about the structure of the virus, we know that. We know every single protein. We know how the proteins act. We know what the virus is dependent on. What we don't know, and this is what's different from person to the virus.
Dr. Rutland, we're having a little bit of difficulty here with your feed. Okay, so you said, if you're back, you said what we don't know, and then that's where we ended.
Right. So what we don't know is your immune system's response to the virus's presence. We don't have an understanding of that very well.
Okay.
And so symptoms come from your immune system responding to the virus.
Symptoms come from your immune system responding to the virus. So for my viewers, it sounds like that, again, and like you said, the nomenclature, so let's get our terminology right? There's the virus, and then there's the disease, okay?
Right.
And so when you were talking about the virus, you actually mentioned that there are 7 different viruses, correct?
There are 7 different coronaviruses. There's only one SARS-CoV-2, but there's 7 different.
7 different coronaviruses. And for clarification, is there, okay, we're still having a little bit of difficulty here.
I can hear you.
But we're having some, so I'll just keep talking. For clarification, is there one particular coronavirus that is impacting our nation, causing the pandemic and the globe? Excuse me, the global pandemic.
Yes.
Okay.
Yes, that is SARS-CoV-2.
That is SARS-CoV-2. Got it. Thank you for that clarification. So now when we go here, we're talking about how what is unknown is how it will impact the systems of the immune systems of individuals. The immune systems of individuals, are those like a fingerprint, like where everybody has a unique immune system? Are there classifications of immune systems? How does that work?
You know what? You said it very well. Everybody has a fingerprint. Everybody has an immune system that acts in a certain way. Now,
okay, we lost you there.
Function, right? And so your immune system has a function. So there are different white blood cells that have different jobs to do. And as they're doing those different jobs, sometimes they produce molecules. Most time they will produce molecules that recruit other types of white blood cells to an area. Now, depending on who you are, you might produce more molecules than someone else, which is going to lead to a significant more amount of inflammation within your lung or within your blood vessels or within your body. That's going to cause your system to overreact and you to go into profound organ failure. And some people don't. Some people get the virus and they're fine. Some people get the virus and they're really, really sick. And that's something that we have trouble gauging based on people's immune systems. We're not very good at obtaining that signature. How do I know how this person is going to respond? And that's what makes it very...
Got you. Okay, and so you can hear me. So actually, we've got a couple of questions here. I want to go to that question number 2 about people who may have a, yes, hello, doctor. Do you feel a smoker has a greater chance of getting COVID?
So smokers actually have, they're 2.5 times more likely to test positive for SARS-CoV-2 because you smoke cigarettes. We know that data, it's out there, it's done. So yes.
Okay, so yes. Now I want to move into the conversation around, let's talk about the Black community and some of the maybe diseases or ailments we may be predisposed to. So if we see hypertension or we see, and again, nomenclature is important. So you stop me when I'm not saying something right. But if we're talking about diabetes or different things like that, does that, now we know that disproportionately Black and Latino individuals have been affected or impacted by the virus. But does that also have to do with some of the conditions that may be more prevalent in our community, such as diabetes or hypertension, things like that? And how does the virus interact with those conditions?
Really what we're talking about is what the virus's presence accentuated, what it exacerbated was healthcare disparities. And I know you talked about it with my boy and your boy, Atalo, maybe a couple of weeks back. But healthcare disparities exist, and that is probably more than half of the problem that you're having. Now, Black people do have a disproportionate amount of high blood pressure, which is hypertension. We do have significant, weight problems, obesity, which can lead to obstructive sleep apnea. We know that obesity and hypertension are kind of the biggest risk factors for the development of COVID-19, of severe COVID-19 as a result of the virus's presence.
Okay, we've got a little pause in the feed.
It's so much that, listen, our people have a tendency to have X, Y, and Z disease, probably because of healthcare disparities. So we need to be slightly more cautious, and we need to understand and develop an understanding of what chronic illness means and what we can do about that to help our situation.
Got you. I want to move a little bit to, we had a question there, and we don't need to put that up, but we're talking about the effectiveness of the forthcoming vaccine. I know I posed that question in our thing where I said, should we be skeptical of the vaccine? And you had a response and saying, I want to talk about the effectiveness and how safe is it. We are going to talk about the skepticism because I want to go into that, but there's been a lot of, media surrounding the process for developing a vaccine. So I want to first, before we dive in, just if people don't know, what is the typical timeline for a vaccine to be developed, and how, based on the timeline that, Operation Warp Speed is putting out there from this administration, how that measures up to what our normal kind of timeline would be for the development of a vaccine?
Yeah, so that's a great point. First of all, Operation Warp Speed is a kind of an administrative process that allows multiple events to take place simultaneously instead of chronologically. So typically speaking, when you're developing medicines, you develop them in a chronological way where you do this first, this second, this third. And sometimes we kind of roll our eyes and we're like, why do we have to do this first and this second, this third? Why can't we do it all at the same time? Operation Warp Speed allowed us to do several of these processes all at the same time. But the safety remained intact. So the safety of a medicine or the safety of a vaccine development always remained intact. What you saw recently as a result of AstraZeneca,
this is important.
That 1 out of 18,000.
I want you to go. I want you to go back. Yeah, I'm sorry, because we lost you there. You said what you saw, and then we lost you again. So.
Oh, okay. What you saw recently with the AstraZeneca vaccine, which was the adenovirus vector, is you saw that 1 out of 18,000 people end up getting a side effect of what's called transverse myelitis, which is autoimmune inflammation of the myelin sheath, which is kind of it's what your spinal cord is outlined by. And everybody was like, oh my gosh, see. But listen, 1 out of 18,000, I don't want to sound like I'm being rude or mean or ignorant, but that's nothing. That shows you how safe it was. The whole trial was stopped because one person out of 18,000 had an adverse event that affected his or her life at that time. That demonstrates safety. That doesn't show that something. So
I want to again, Dr. Rutland, you're giving us such great information, but we're just having a difficult time with the feed. So you said again, it showed the safety, and then we lost you. So we gotta see if we can.
All right.
Listen,
So,
folks, I
listen.
hope you're getting this, and we're going to do our best to make sure that you're getting the clear information. It looks like we just lost you. Okay. Oh, he's back. There we go.
No, so I moved to a different spot.
Okay.
So
There we go.
what that shows you is it demonstrates safety of the vaccine, because 1 out of 18,000 people who got that side effect, they stopped an entire trial. So that should show you that, oh, wait, safety protocols are in place. And in fact, this is showing that the governments, the world does care about patient safety. So I don't want people to be concerned about the status. I would rather people be concerned whether or not the immune is absolute and necessary and appropriate. And it is in almost every vaccine trial that we have out there.
Okay. So when we're talking about that, so in your expert opinion, if there is a vaccine that is made available, would you advise our audience members this evening and the patient and your patients going forward, if it is following the cycle in which the timeline in which you have just described and what we have, despite the earlier release than maybe other vaccines, are you saying that you would recommend individuals taking the vaccine? Can you say that? Or,
Yes, I would look at it like this. Yes, I would. You guys everybody has to understand something. This.
Oh my gosh. You guys, this is killing me. This is killing me because he's like starting and then we lose you. Okay, so he said we have to understand something.
Am I here?
You're back now.
All right. Sorry guys, I'm so sorry. I'm in between jobs. This type of process takes place all the time. Viruses can mutate. Things can happen. I want you guys to think about history, in which you're reading a history book and you hear about a civilization, and all of a sudden, one day they're not there anymore. What do you think happened? You think they went to space, to another planet? No, this is what happened. There was a pandemic. There was an infection. This takes place all the time. And so for people to think that we're living in this world in which we can't be affected by viruses and bacteria and fungi is ridiculous. And what this is demonstrating, and what this is actually showing scientifically, is what we're training for right now, this pandemic, with the next one, because it's going to happen again, and it's going to happen again. There's always going to be a new virus that looks different, that mutates. And so being able to develop a vaccine or a therapy or a treatment quickly is of the utmost importance. And right now we're practicing and we're learning how to do it, because sometimes taking 30 years of time to develop a treatment regimen or a medicine is way too long. Yes, we have to go through our typical protocols. And yes, we have to make sure treatments are safe. And yes, we have to look at long-term outcomes. But sometimes when you have things such as this, a pandemic in which you have 37 million people affected worldwide, 7.5 million people affected in the United States, sometimes you got to be able to get through these protocols, allow science to do its thing, and allow people to be treated appropriately, safely, and most importantly, effectively.
So when I talked about skepticism, you brought up the point that you actually would like to see more African Americans, Black folks participating in trials. I myself saw a commercial that said basically was asking for volunteers to participate in the clinical trial around the vaccine. I'm going to be honest, because this is the naked truth. And I've said it to friends and people in my circle. I'm skeptical about engaging in anything in regards to what I feel like is this medical testing, and not knowing what is going to happen, so on and so forth. And there's skepticism, widespread skepticism in the Black community based on historical facts around experimental, the Tuskegee experiment, so on and so forth. Talk to us a little bit about African Americans, from your expertise and opinion, about African Americans participating in these type of trials, in particular in COVID-19 and as the pursuit of the vaccine.
So in 1932, the Tuskegee experiment began. And there were 600 black men, 400 of which had syphilis or latent syphilis. And the government told these black men that you're going to get free health care. And they let the black men with syphilis have syphilis. And they got all the complications of syphilis, even though a cure existed, which was penicillin. The 40 years of experimentation on black men, which was way more than 40 years, by the way, 40 years of experimentation on those black men has led to a significant amount of distrust in the healthcare system today, right? And that I understand. And part of it could be because there's not a whole lot of people that look like me taking care of people. Part of it could be because where we go to talk about health is not where white people go, right? And I'm not trying to be divisive or be racist. My wife is white, okay? But what I'm saying is that, like, when I
hold on, hey, no. Dr. Rutland, I'm gonna pause you there because all you said is what I'm saying is, and then we lost you.
Yeah. All I'm saying is that black men go to different places to get information, to get to receive public health. We go to the barbershop. All of the people go to my barbershop. They know when I'm coming in. I go every 4 days. They know I'm coming in. And when I'm there and they're there, they're asking me all kinds of questions about their health. That's not where white people go. White people actually go to the doctor. We go to the barbershop. There have been several studies in which we deliver care in the barbershop and patients do better than being delivered care in a clinic, right?
Wow.
In terms of black people.
Wow.
So we have to know, we have to have more black people in healthcare. We have to teach people that cultures are different. This is where we're receiving care. Yeah. This is how to talk to Big Mama. This is how to talk, you know. There was a story the other year, pulmonary or pulmonary 70-year-old black woman who was in the ICU. And I went in the room and I said, "Hey, Mama, how you doing?" You know, and her eyes kind of lit up and we started talking. And we left the room and my attending, white guy, ponytail, said to me, "How did you know to call her Mama?" And I looked at him dead in the face and I was like, "It's an Aunt Mimi case," which is what he would say to me all the time. And he was like, "What do you mean, Aunt Mimi?" And I was like, "Only you know your Aunt Mimi. This is a lady who is like my mama. I'm gonna call her Mama. Like we know how we are. Like I called your mama Mama. You know what I mean? That's how it is. And so that's the kind of thing that has to happen. Is you got to be able to teach that kind of culture across medicine for everybody, because walking into a white person's room and walking into a black person's room is different. When I walk into a black person's room, a patient of mine, I know I got 10 years of catching up to do. I got to teach them everything I know about their health, catching up to where they are now, because I know that they have not been educated.
Okay. Listen, gosh, Dr. Rutland, you, Jamie, you, I'm telling you, this internet is trying to defeat us, but it will not prevail, right? Okay, it will not prevail because you're saying so many great things. I want to be respectful of your time because once again, as we've acknowledged, you are in the middle of shifts. There's a few questions here, and I do want to touch on, you've talked on your lives about the flu and COVID. The flu and COVID. As I was listening to your lives, you talked about the incubation periods. You know, with COVID, it's 2 weeks on average. With the flu, it's 1 to 3 days. But the symptoms are very similar. So you were saying in order to distinguish one from the other, it's important to know who you've been around. Is that correct? Oh, okay. All right, we're gonna wait till we get him back. I don't know if I think we got you back.
Am I not back?
So yeah. So you said it was important to know who you've been around. So people who are asking, how do I distinguish between if I have the flu or I've had COVID? Would know who you've been around, make sure that they're tested. What else would you tell people in regards to that?
Yeah, I think that if you're wearing a mask right now, and you continue to wear a mask, it's going to be rather difficult to get influenza. It's also going to be more difficult to get coronavirus, and it is tough acutely to distinguish between the two unless you have contact tracing. So if I was with a friend of mine who I know had COVID or got diagnosed with COVID, and I
All right. Yeah, we lost you there. We lost you again.
Gotta know who you're with. You
gotta know who you're with. Got to know who you're with. I want to hit a couple of questions before we have to let you go. So, if you've tested positive for COVID-19, is it positive to have a reoccurrence? And you've survived the first round. Is it possible to have a reoccurrence?
You can have a recurrence, right? There are two or three cases in the country that have been described in which people have had SARS-CoV-2 once and they get it again several months later. It can happen. The infection's likely not going to be as severe as the first.
Okay. How accurate are these tests? We've heard about the rapid tests. We've heard about the tests that take a little bit longer. What would you say is the accuracy of the test? And is there one accurate over the other, more accurate over the other?
All tests are over about 90% accurate. So the tests are pretty accurate.
Okay. So tests are pretty accurate. Somebody asked, along with the testing, how often should people get tested? Is it just when you're feeling symptoms? If you are been around in high traffic areas, what would you suggest? How often should people get tested?
I see COVID every single day of my life, and I've been tested maybe 3 or 4 times. So I would say if you have symptoms, you definitely need to have a process in place to be able to get tested. If you don't have symptoms, I don't know if getting a test is really necessary unless you know you were around somebody that had COVID, like in the NFL. Okay. When Stephon Gilmore, who's been covering receivers all weekend, ends up with SARS-CoV-2, all the receivers he was covering need to go get tested in addition to the rest of the football team.
Okay. Julius, go ahead and put that question up about COVID and swine flu. Okay. What's different between the swine flu and COVID? Is the death rate similar? If so, do you think COVID pandemic is largely driven by politics, given that the swine flu outbreak didn't shut down the economy? Okay. It's a lot in here. So again, difference between swine flu and COVID. Let's start there.
Okay. So the swine flu is an influenza virus. Okay. I think it was H3N2. So what happens with the flu is every single year on the outside of the flu, the structural proteins of influenza, more specifically hemagglutinin and nucleocapsid protein, they change the way that they look just a little bit by about 2 or 3 amino acids. And that really fucks up your immune system. Your immune system does not recognize it. I go through the difference in one of my YouTube episodes, influenza versus coronavirus. It's on my Medicine Deconstructed channel. But your immune system overreacts. Just like it does with SARS-CoV-2, your immune system doesn't recognize it, so it overreacts. Now, the pandemic is not driven by politics because I'm watching people die. So I can't walk in somebody's room and say, "Oh, it's political." Bye. Like, it doesn't work like that, right? So when people say things like it's driven by politics, these are obviously people that have not seen a patient and they're not physicians, and so they shouldn't say that shit. That shit needs to be taken out of your mouth because that's not right to say. Because if it was your mom in that hospital bed, you wouldn't be saying that. All right. There are 36 million cases worldwide. Swine flu was a lot different. There weren't nearly as many cases. Yeah. And so, again, when you're looking at this, the viruses are different. The process by your body is essentially the same. Your body doesn't recognize it. And so it can overreact.
Yeah. Listen, I'm watching the time here, and I want to just give an opportunity, Dr. Rutland, for you to just give any closing comments, just a few comments of words of advice, medical advice for we have a broad audience out here who are watching you today. And what would you say to them about going forward into the flu season and as we continue to traverse this pandemic here? Any closing thoughts or words you would have?
I would say wear a mask, get your flu shot, and make sure that your body is treated like a temple. Exercise, take your vitamins if you need them, eat right, eat healthy. And if you have questions, just ask. We're all happy to help you. We want you to see your physicians. We want you to take care of yourself. We want you to be as healthy as possible. But please wear a mask and wash your hands.
Yeah. Listen, man, Jamie, I appreciate you so much. It was a pleasure to have you here on the platform today. If you need to listen, he's got a YouTube channel, Medicine Deconstructed. So please go to YouTube and subscribe. A lot of the questions, I did not get a chance to get to everybody's questions, and I do apologize this evening, but you can definitely see more answers to some of the questions that you have. On his YouTube channel. You can also go to Dr. Rutland's IG page, Dr. J. Rutland, and you can find him there. Actually, and we're going to make sure that we have him back on. I'm looking at our comments here, and he says we'll be able to do this again at a later time. We'll get a stronger connection for him. But I want to say thank you to Dr. Rutland for his time, for his expertise, and for his candor. Because as you can see, he does not hold his tongue, which is extremely important here when we are talking about lives, you all, lives. 210,000, over 210,000 Americans have succumbed to this pandemic, you all, and there's an even larger global number. So again, our hearts and our prayers go out to all of the individuals who have been affected, who have lost loved ones. And just, we're here for you. We're praying for you for that comfort and the peace in such a very difficult time, and knowing that we're going to be going into the holidays. I want to thank all of our folks, our team, Julius Jones, who is my illustrious producer. I thank him for today and for all that he does, every single episode and leading up to it. And I want to thank Dan, the little wine guy, and Dan Cericia, all the way out there from Napa, for teaching us how we begin the tasting process of wine. I'm telling you, it's more to come. And this is a very tasty wine. So if you want to try out something new, please make sure you do that. Tell people about the Naked Truth Experience. We are here every Thursday at 9 p.m. Eastern. You can find us on Instagram, find us on YouTube, like, subscribe, and share. Like, share, and subscribe, you all. It is very important that we continue to get the word out there. We work very hard to make sure that we bring the professionals, we bring the heart, and that we bring the sincerity and the transparency that is important to have some of these very difficult yet important and transformative conversations week to week. So we need your help to spread that message. I want to thank each and every one of you for coming out tonight. I want you to come back next week, because next week, in honor of National Domestic Violence Awareness Month, we're going to be talking about enough is enough. Love is not violence. Again, this is going to be a very, very touchy subject, but a very important one for us to talk about: domestic violence. And I want to talk about domestic violence not just in the traditional sense. So I want to hear from our LGBTQIA plus community where there is partner violence. I want to hear from individuals, from men who are in heterosexual relationships, but who may have partner violence from their spouses, from their partners, from their female partners and spouses. So again, we're going to keep going in depth with this conversation. It is the Naked Truth Experience. I appreciate you. I want to see you back next week. You all have a wonderful night.